The program airs from 10 a.m. Monday through Friday. Today we have Dr. Okoli Chidera, a general practitioner, joining us to understand how health concerns affects people of all ages and occupation, understanding waist pain, what you need to know, and how to find relief. Waist pain, commonly referred to as lower back pain, is one of the leading reasons people visit hospitals or miss work. While it is often linked to poor posture or heavy lifting, it can sometimes be a sign of an underlying medical condition that requires prompt attention. Today, we will discuss the common causes, symptoms, treatment options, prevention tips, and when it is necessary to seek medical attention. My name is Hassani Natula. The phone lines will be open shortly for you to ask your question. But before then, it's a 7 minutes past 10, and this is Radio Doctor on Women Radio WFM 91.7. The doctor's contact details will be shared at the end of the program. Good morning, Dr. Okoli. How are you? Hi, doctor. Good morning.
Hello, good morning. How are you?
I'm good, thank you.
Oh
Thank
yeah,
you. You're welcome to Radio Doctor.
yeah, thank you. I've been here before. This is my second time talking on the radio doctor.
Okay.
Yeah.
Doctor, what exactly is waist pain? And is it the same as lower back pain?
Oh yeah, I don't know if I'm audible enough.
Well, if you can be louder,
So yeah,
but
weight
hear you.
is basically the same thing with lower back pain, right?
Okay.
It's just basically when you're feeling pain in your lower back, you know.
Mm-hmm.
So that's just what it is.
Okay.
Pain is an abnormal sensation that tells you when your body is hurting. So it could be a minor something, or it could be a sign of an underlying condition. All right.
Mm-hmm.
So this topic is very important because it's something that we see in the hospital very frequently. Most people don't even come to the hospital because it's something that you could just go over the counter and get drugs, right? So I'm happy to be here to actually dissect the topic of waist pain and also focus more on prevention rather than management.
Okay. How common is waist pain among adults?
Waist pain is very common. One in seven in at least 7 in 10 patients who come to the hospital or to the pharmacy or chemist are patients who present with waist pain. So it's actually very, very common.
All right, doctor. What are the most common causes of waist pain?
Well, there are a lot of causes of waist pain, but in our environment, I think the most common cause of waist pain is poor posture. Yeah, poor posture is the most common cause of waist pain. Poor ergonomics is actually the most common cause of waist pain. We also have trauma. Trauma could also be a cause of waist pain. Then before we go into all those not so common causes, but are very important, like diseases, your underlying illness conditions, cancer, and all whatnot. Yeah.
What are the all of that, doctor? Because you've answered parts of my next question. Medical conditions like arthritis, kidney diseases, or infections, and also physical labor. How do they affect waist?
Oh yeah.
How do they affect waist pain?
You know, yeah, when it comes to waist pain, right?
Hmm.
There's always the need for you to be evaluated in the hospital because it's not just about taking drugs. There are a lot of your waist could be a sign that something is the problem. It could be, as like you said, it could be a sign of an infection ongoing that is being referred to your waist. Of course, when it comes to the pelvic region, there are a lot of organs there. In the woman, there's the uterus, the ovaries, the bladder. And in the men, there's the prostate, right? So
Mm-hmm.
the inflammation, what we call inflammation, is like the body reacting to an effective process. Okay, so when it's happening, then you might not necessarily feel that pain. Maybe from your uterus or bladder, it might just be referred to your waist, and that is the only way you can find out that you have an underlying condition. So a man who has a prostate cancer might not. Most times, prostate cancer now is very asymptomatic, right? So the only symptom that you might have is that your waist is paining you. So when you go to the pharmacy or the chemist, you get drugs, the pain can stop, but you've not treated the underlying condition. And that is why when you come to the hospital and just say you have waist pain, the doctor goes through a series of questions to ask you what other symptoms you could be having, so that you can find out what is causing your waist pain, and also do a lot of investigation from your blood work, your urinalysis, and your cell chemistry, to find out what could actually be causing this particular pain, because I can't exhaust the causes. It's a whole lot. It's a whole lot. Yeah.
Hmm. Okay, between both genders, male, female, which gender is more likely to experience waist pain? Is it a gender thing or just general anybody?
Honestly, I wouldn't say it's a gender thing, because it affects both gender almost equally. But women, especially women who are in their reproductive age, especially women who deliver through vaginal delivery. When you're in vagina, um, you have a lot of distortion in those pelvic angles that comprise the angles that make up the waist region. So when those distortions are there, over time, the ligaments and everything around there become weak. So women become more likely to experience waist pain. However, waist pain is usually common once you're above 40, 45 years. So it becomes a red flag when we are having someone who has no obvious reason to have waist pain, who is maybe less than 30 years, maybe 18 years old guy, or 20 years, 25, having this waist pain that will bring you to the hospital. So that is where the doctor's tentacles become very hard to actually find out what could be causing this waist pain. But as a general rule, right, I wouldn't say it's common in any gender. I wouldn't want to, I'm not sure of the statistics, right? But I would say that women are more likely to be exposed to normal physiological waist pain because of reproduction and the fact that they go through childbearing processes, and that area can get weakened over time. Yeah.
All right, thank you very much, doctor. Does being overweight increase the risk of developing waist pain?
Of course. Of course. But it increases the risk of everything
Sorry,
in
I
your
can't
body.
hear you. I can't hear you. You're sounding very faint.
Can you hear me?
Yes, it's better. Not very clear, but it's better.
So I said being overweight increases the risk of almost everything in your body, right? It's just like normal physics. When the weight is too much, because your body is made up of skeletons, and that skeleton is like your supporting structure of the body. And if your weight is too much, the skeleton becomes kind of weak or compromised. So when you put in too much weight that is above the skeleton's ability to hold on, it gets tired, and of course leads to conditions and waist pain, arthritis, and all the rest, disc prolapse, disc slippage, and or whatnot. So yeah, waist pain in fact is one of the common risk factors. Sorry, obesity is one of the most common risk factors for waist pain. So most times when we see patients who come to the hospital because of waist pain and they are overweight, the first thing the doctor does is to advise and counsel the patient on the need for weight loss. Yeah, so yeah, obesity is actually something that is very important when you're talking about waist pain.
All right, doctor, if someone has persistent waist pain or isn't sure whether it's something serious, how can telemedicine help?
Yeah, telemedicine can help you in a lot of ways, especially when it comes to waist pain, because when it comes to managing waist pain, there are what we call red flags. All right. So it's different when someone comes to the hospital and says that, Doc, I have pain in my waist. It just started yesterday. I lifted something and since then I've been having pain. So that could just be a strain of your muscle. It most likely will resolve. There's no need to start working up the person for excessive investigations, right? So, but when
Mm-hmm.
someone comes to the hospital, starts telling you something like, I have waist pain for the past 6 months. Since then, I've been noticing that I've been losing weight. I've been having other symptoms. I've been coughing, or maybe I've been having heart too, or I've been having difficulty passing urine. So in that case, now it's not something that you can just say, okay, do this, we'll go and get so drugs. You actually need to be investigated in the hospital. You need to do a lot of labs. You need to do a lot of imaging, because in fact, something that is very common, and especially in the rural areas, is what we call spinal tuberculosis. So spinal tuberculosis is when you have tuberculosis that has invaded your spine. So most times the person presents with weight loss and excessive or frequent coughing, sometimes coughing out blood. So in that case now, telemedicine can help you by directing you to the appropriate quarters. Okay, it might not necessarily treat you at the spot, but at least it can help to direct you. Because I believe sometimes you might not be able, because people, people are scared of coming to the hospital because um, they fear a lot of things. So, but with telemedicine, right? When you're aware now that you're seeing a doctor, and the doctor tells you, hey, sir, we can't manage this here, we can't help you here, but you need to go to so hospital. And I mean, yeah, so some of those red flag symptoms, like I mentioned, erectile dysfunction, constipation, weight loss, um cough, hard stools, and all those stuff, are actually red flag symptoms and waist pain that need to be investigated very thoroughly.
All right, the lines are now open. You can call us on 07000 917 917 or 09155 917 917 or 0800 1235 917. You can send a text message, a voice note, or a WhatsApp message to 08155 917 917 or 0703 1756 537. Today on Radio Doctor, we are discussing understanding waist pain, what you need to know, and how to find relief. If you have questions about persistent waist pain, posture, exercise, pregnancy related back pain, or treatment options, now is the time to call and speak with our guest doctor. All right, so doctor, when should someone with waist pain seek medical attention?
I feel at any point you have waist pain, you should seek medical attention, right? Because a lot of things can cause waist pain, like I mentioned, and it's not good for you to, overlook something and it continues progressing, right? So, in as much as we say there are red flag signs, but whenever you have waist pain that has lasted more than 2 weeks, consistent, I think you should see a doctor. Yeah, to see a doctor. And there are a lot of things that I need to mention here, because I think we should people focus more on the treatment of waist pain rather than the prevention of waist pain. There's what we call ergonomics, right? The way we live our daily life can actually affect our waist. For example, when someone works, it's a 9 to 5 job, you tend to sit down most of the time. That habit is very harmful. Ideally, that's what we call the 30 minutes rule. You shouldn't sit down for 30 minutes straight. You should at least stand up, walk around a little, sit back, because it helps to relax those muscles. It helps to increase blood, cause improve circulation around the body. So this is something that a lot of people do that I just want to draw our attention to. And sometimes the way we sit also, it's something that I need to talk about. A lot of people have poor sitting positions, probably because the chairs are not well constructed. Ideally, if you want to sit down, you should endeavor that your buttocks, the back of your buttocks, touches the back of that seat. Yeah, that should be the right sitting position, and that your back, touches the back of the seat also. But you see some people, when they sit down, the buttocks doesn't, the buttocks is just half in the seat, and they bend, kind of relax on the chair. So that thing alone puts a strain on your lower back, right? So that's something that I need, for our listeners out there. to know that how you sit matters a lot. And because over time you don't know, you continue sitting like this, and before you know it, you start having this chronic back pain. Thirdly, there's what we call how to bend. For example, let's say you're walking down and your pen falls on the floor. You don't need to flex to pick up that pen, right? You don't need to. When I say flex, I don't. You don't need to form an angle when you're picking up your pen, because that alone can put a
I'm so
strain.
sorry to cut you short, doctor. We have a call.
All right.
Good evening, Grandma Ayeni.
All right.
Hello, good morning. God bless you, Moto. You recognize. God bless you.
Good morning.
I'm Grandma Ayeni from Arepuma.
Okay.
So I want to ask a question that, is there any difference between waist and back pain? That's my question number one. For how many minutes or hours can an elderly, like me now, 74, can I jog? I'll go back to because I'm managing myself. Hello.
Yes, we're listening, ma'am.
Hello.
We're listening.
I said that like how many hours or minutes can I jog in the morning? I say 74 day woman.
Okay.
And that backache and waist back pain and waist pain. What's the difference? Because I want to differentiate.
Okay, doctor. She was asking you a question.
Yeah.
She said, how many minutes do you think she should jog? And is backache and waist pain the same? She's asking based on the fact that she's elderly.
Okay, so that's a very important question, right? So now, normally the back is like, there's the upper back, there's the middle back, and there's the lower back, right? The upper back and the lower back do not include, and the middle back do not include the waist. So when you're talking about back pain, you need to be specific, okay? You need to tell us, are you having upper back or middle back pain? Because when you talk of lower back pain, now you're talking of the waist, okay? So when you say back pain is like the father of everybody, then lower back pain or waist pain now is when you're being specific. So yes, there's a difference between back pain and waist pain. When it comes to the medical field, we need to be specific. Where is your pain coming from? Is it the back, upper back, lower back, or middle back? So, but when you talk about waist pain now, you're talking of the lower back. So I don't know if I answered that question very well for you.
Yes, I've gotten it.
Yeah, ideally, you're supposed to work out, if you're jogging, for at least 15 to 30 minutes, depending on how strong you are and how fit you think you are. At least 30 minutes per session is okay, at least 3 or 4 times a week. I think one of the things I will need to tell you is that when it comes to jogging, you need to just start slowly and then increase it, as the energy comes. But the ideal timeline for you to jog for per session should be at least 30 minutes per session for an elderly, for your age. Yeah, and then you repeat this at least 3 to 4 times a week. But if you have, of course, we can never say never in medicine. So if you feel like you still have energy in you, you can still go more than 30 minutes, right? But the ideal time frame or the medically acknowledged time frame for you to jog every session should be about 30 minutes. So I don't know if that is okay.
Thank you, doctor.
All right.
I'm okay. Thank you, doctor.
All right.
Bye. Have a nice day.
Yeah.
All right. Thank you, Grandma Ayeni, for calling. So, doctor, is imaging such as X-rays, CT scans, or MRI always necessary to determine the cause of waist pain?
Oh yeah, that's a very important question. In fact, I think that's what we need to put out there. So, because sometimes when patients come to the hospital, they always want to have an X-ray for every cause of waist pain. So now there are certain types of waist pain that that imaging will not really change the course of management, right? So especially when it comes to X-ray, routinely we don't order for MRI and CTs. So X-ray, because how we work is that when you look at this pain, you know that the cause might not really be something sinister. you don't really need to do imaging, right? You just need to give the person some drugs, muscle relaxants with physiotherapy, because imaging might not necessarily change the course of management. Imaging, especially X-ray. So X-ray is not routinely needed to investigate the cause of waist pain. However, when this pain becomes chronic, or when this pain becomes, starts to have red flag symptoms or becomes persistent, then we could go for an MRI. That's going to give us a thorough picture of what is happening there. Although, first of all, before you do an MRI, you need to start with an X-ray. Okay. There are certain causes of waist pain that are very rare, although very common. I've seen one case since I started practicing. That's what we call ankylosing spondylitis. Usually common in females under the age of 40. So and then whenever you do an X-ray, you see it's clear on an X-ray with other blood work you do. Right. So to answer your question, yeah, imaging is not routinely required. So it's based on your clinical judgment as the doctor. Yeah.
Mm.
And imaging is not just the only thing we need to investigate when you are managing X-ray. You need to do a full blood count. You need to do a thorough. In fact, you need to investigate all the systems if you want to do a thorough, investigation on that patient. Yeah.
All right. Can waist pain resolve itself? Oh, what am I saying? Can
Yeah.
waist pain resolve on its own without treatment?
Yeah. Of course.
Okay.
Especially when it comes to these acute types of waist pain, these ones that we call strain or sprain, especially muscle strains. Most times you don't really need to take any drug. All you just need to do is massage. Sometimes even if you don't massage, you stop noticing it. So yeah, with some types of waist pain resolve on their own. So, but the problem is that because the exposure in our environment is consistent, right? Most people, we don't know how to sit, we don't know how to bend, so you continue to expose yourself to these risk factors that will cause you this persistent waist pain. So most times it's difficult for you to see someone that comes and say, my waist pain is gone, because you're frequently, re-exposing yourself, so to say. Yeah.
All right. What role does physiotherapy play in treating waist pain?
Physiotherapy plays a very, very important role. In fact, physiotherapy, I would say, plays 70% of the role in treating waist pain, because basically what physiotherapy does is to realign those angles that have been misaligned, right? So in fact, when it comes to managing waist pain, for me, from experience, I would say physiotherapy is even better than drugs, because most of these drugs anyway have side effects. And when you're managing chronic waist pain, you can't just continue popping pills for the rest of your life. All right. So I think, yeah, physiotherapy has a very major role to play when it comes to managing waist pain. The whole massage, acupuncture, and all those stuff that we do in physiotherapy. So I mean, yeah. So I think that's something that if you have chronic waist pain, I think you should have a physiotherapist hotline that can be coming to give you some management for your pain.
All right. When is surgery considered for waist pain?
Well, surgery. Well, surgery is like the last resort when it comes to managing waist pain, right? And honestly, the outcomes are not very encouraging anyway. But when it's considered is when the pain starts to have red flag symptoms. For example, when someone has a disc prolapse that has become so much that he can't even walk, or she can't even walk. Maybe the person cannot walk, like it's that bad that you can't walk. At that point, you might consider opening up and loosening up those compressions, right? So yeah, maybe in some cases of trauma, some cases of trauma too, surgery can actually be considered. But I want you to know that when it comes to managing waist pain, surgery is the last resort, and it's a 50-50 thing. You understand? There's no guarantee that if you get into the theater, the pain will disappear, and there is also no guarantee that if you get into the theater, that the pain won't disappear. So most times the doctor will tell you this, so it's not left for you because maybe you don't have any other option. then they might consider going into the theater to help you with your pain.
All right. Are there simple exercises people can safely do at home to reduce or prevent waist pain?
Well, yeah, there are exercises you could do at home to reduce or prevent waist pain. Of course, like I said, jogging is something that you could do. Anything that will help you to lose weight, right? Anything that's going to help you to lose weight. Basically, keeping fit. Because what keeping fit does for you is that it strengthens your bones, strengthens your muscles, and all those stuff, right? So any exercise that is going to help you to lose weight is actually good for your waist. But I think exercise is not really something that we should focus on whenever we are dealing with waist pain. What we should focus on is preventing that pain. By the way, like I was telling you initially, our lifestyle, the way you sit, the way you even your bed at home. And that's what we call orthopedic foam. That's the kind of foam that you should be using, right? You shouldn't be using the soft foam that when you lie down it collapses and then misaligns your skeletal architecture, right? So that's what we call orthopedic foam. That one helps you to keep your spine straight. So the way you sit, the kind of chairs you use, and so these are the things that you should focus more on when it comes to preventing this pain. But when the pain has happened now, just rely on physiotherapy. And then have if you have a lot of weight, then you have to lose weight. So that's where exercise now comes into play.
Okay, doctor, what advice do you have for pregnant women experiencing waist pain? Oh, doctor, I can't hear you.
I didn't get you.
I can't hear you. I said, what advice do you have for women experiencing waist pain? For pregnant women experiencing waist pain.
Okay, so yeah, the advice I have for pregnant women experiencing waist pain is that pregnancy is a very common cause of waist pain, and that in fact there was something I was going through on Twitter the other day. They said whenever you come to a doctor and this small thing you ask you when was your last menstrual period, so someone was explaining and said that sometimes whenever you're investigating women, especially when it comes to pregnant women, you should always ask for the last menstrual period so that you can know. Sometimes all these x-rays and stuff we do, and even the kind of drugs that we take can affect the child. So for pregnant women experiencing waist pain, I would say first of all, understand that it's normal in pregnancy, especially when the pregnancy is advancing, because your stomach, your abdomen is protruding and it's actually impinging on your spine. Yeah. And I think another advice I have for them is that no matter the kind of pain you're having, always consult a doctor before you take drugs, right? Our advice is if you want to take drugs, the best and safest drug in pregnancy that you can take is Tylenol, or what we call acetaminophen, paracetamol. Yeah, that's the only drug you can take. And then I also advise them not to do imaging anyhow whenever they're pregnant. Maybe when the pain becomes too much, they might just walk into a facility and say, I want to do an X-ray. Some people, some people might just want to make profit. They will not tell you the risk of that X-ray that you want to do. So I would say for pregnant women experiencing this thing, it's advisable not to seek medical care anyhow for your waist pain. Focus more on physiotherapy. Focus more on having a good posture or lying down on a bed that is straight. Focus more on exercise. Yeah, focus more on exercise, and of course, your husband also has to be there to give you those massages, especially when the pain becomes very, very unbearable. So these things can also help you with your mental health and emotional health too. So yeah, I think that's the advice I have for pregnant women who are experiencing waist pain. But usually after the pregnancy, give or take within 2 to 3 weeks, the pain usually subsides. The only thing that happens is that the ligaments will not become weak, so you become more prone to developing waist pain later, in life. Yeah.
Hmm. Finally, what important message would you like to leave with the listeners about waist pain and seeking timely medical care?
So I didn't get a question.
Okay. I said, finally, what important message would you like to leave with listeners about waist pain and seeking timely medical care?
Okay, so yeah, the important message I would love to leave for our listeners who are experiencing waist pain is that we should focus more on prevention rather than treatment of waist pain, right? From my experience, waist pain, once it happens, it's usually very difficult to go away. So my advice to listeners is to focus more on lifestyle modifications. Focus on the chair in your office, the bed you use at home, the way you even walk, exercise more often, have a good diet, move around often, stop sitting down for 8 hours in the office straight. You understand? Exercise, walk around, avoid putting up too much weight, avoid some drugs, especially our gym bros who go to the gym and abuse steroids. Avoid some of these steroids because they can weaken your bones and, of course, cause you pain. Right. So I think this is the advice I have for our listeners. Let's not focus more on treatment because when it comes to treating waist pain, apart from drugs and physiotherapy and surgery, there's nothing else you could do. You understand? And then maybe rising research on all these acupuncture and all these neuro modifications. Yeah, but all those things are quite expensive. So you don't want to start putting yourself in that position. But there are certain lifestyle things you can start doing today. For example, when your pen falls down, you don't need to bend and flex to pick it up. You can just squat and pick it up. That can help you. When you go to your office, instead of sitting down and bending somehow, make sure that your buttocks, the back of your buttocks, touches the back of your seat. That is the right sitting position. And then make sure that your hips and your knees are at a 90 degrees angle. All right. And these are the things. And your table too in your office, if it's too high, you understand? Because we are just talking of waist pain now. We should also focus on upper back pain. These are also things that can cause you pain, like the woman that asked about back pain. When you're looking at your phone, you don't need to be putting your neck on your chin or your chest to be looking at messages. You could just raise your head up at the same time and watching your screen. So these are certain lifestyle factors that we could do that can help us avoid back pain in general. So this is the advice I have for our listeners. And also, whenever you start having persistent waist pain, let's say more than a week, more than 2 weeks, we have a teledoc here. You reach out to a doctor to tell you what to do. So it's not just enough you pop pills, because the more you pop pills, the more you're masking your symptoms. So it could be an underlying something. I once had a patient who had a prostate cancer. He was asymptomatic. There was no sign. The only thing he was having was waist pain. And the thing that gave her the waist pain was that it kept on waking him up at night. So at night he wakes up because of back pain. That waist pain is too much. And that was how he came to the hospital. We did an imaging. We saw the metastasis and all those stuff. And then he was diagnosed of cancer. Eventually he passed away, right? So that was the only thing he presented with. So at some point, you don't need to rely on just buying drugs and self-medication to treat waist pain. And there's a rising incidence of kidney issues in our country, because a lot of people are popping pain drugs, NSAIDs, painkillers, and all that stuff. So when you take these things too much, it could actually damage your organs, because drugs, in as much as they help us, they are also poisons. So you don't just take it when there is no clear indication. So always use Teledoc app. It's very easy to use, very affordable. Whenever you have pains, something, or when you want to find out how you can sit, or something as basic as how you can sit, you can always reach out to a doctor, and he's gonna explain these things to you. So yeah, this is the advice that I have for our listeners today.
Okay, thank you, Dr. Chidera, for sharing your knowledge and helping us understand waist pain better. To our listeners, remember that while waist pain is common, it should never be ignored, especially if it is severe, persistent, or accompanied by symptoms such as numbness, weakness, fever, or loss of bladder or bowel control. Early diagnosis and proper treatment can prevent complications and improve quality of life. If you'd like to speak with a doctor, download the TeleDoc app today Book a quick 10 minutes consultation or a full 30-minute session. Choose your preferred time. Upload your medical records, speak securely through video consultation, and receive prescriptions digitally. Thank you for listening today. Radio Doctor on Women Radio WFM 91.7 is Nigeria's first specialized radio health program, broadcast Monday through Friday at 10 a.m. My name is Hassan Matula. Do have a healthy day. Thank you, Doctor, for coming to the program.
All right. Thank you very much. Take care.
Okay, from we at Women Radio WFM